Today I'm going to demonstrate the neurovascular assessment, otherwise known as circulation, motor, and sensory exam. The first step in this procedure is to go ahead and explain the procedure to the patient. The next step is to wash your hands prior to the procedure. And then the next step is to go ahead and do the neurovascular assessment. So the first part of the assessment is to assess, in this case, the distal lower extremity. We're assessing for color, so looking for any pale color to the foot, cyanosis, modeling, any color changes. And I'll also, at this point, ask the patient if he or she is having any pain at this point and ask them to rate that level of pain on a scale of 1 to 10. After pain and color have been assessed, the next step is to assess circulation in the distal lower extremity. I'll start by feeling for the dorsalis pedis pulse. And I've found it there. At this point, I'll assess the posterior tibial pulse. And I've found a nice brisk pulse there. Another part of assessing circulation is to assess capillary refill, which is often done on the toe. So I'll press the toe and let go. In the normal toe, capillary refill should be less than 2 seconds. So after circulation has been assessed, it's important to assess the motor component in terms of the neurovascular exam. So I'll ask the patient to wiggle their toes. Good toe wiggle. I want to assess muscle strength. So first of all, I'm going to assess dorsiflexion. Good. Strength is 5 out of 5. And then plantar flexion. Good. And then assessing the toes. Extension. Good. And flexion. Good. So after completion of the motor portion of the exam, I'll go ahead and assess the sensory. And this is done to light touch throughout all distributions in the foot. This can be done either with the fingertips or a Q-tip, something like that. But it's important to go along all sensory distributions of the foot and to also ask the patient if they're able to feel the light touch. So after completion of circulation, motor, and sensory exams, the final step is to document findings and to place that in the medical chart. And that has been the neurovascular assessment of the distal lower extremity.